The topic for this video today is painful menstruation. The medical name is dysmenorrhea. Again, pain during menstruation is nothing abnormal. It happens between 80 to 90% of females, but the severity varies. Most are very mild and they require nothing. Others can just take Panadol. But in about 10 to 15% of people, it is very severe and they require medication. Like I said, it's a natural process, nothing to be ashamed of, but in the past, women were too shy to discuss it. But it can have severe implications. And that's why we're talking about it now, to let women know that there's nothing shameful in having menstrual pain and you can seek medical attention. There are two types of menstrual pain, what we call the primary dysmenorrhea and secondary dysmenorrhea. The primary one is one that occurs in young girls who start menstruating. It starts a month or two after they start seeing their periods. While the secondary one is one in some people who never had it before, and suddenly it starts. And in those ones, there are reasons, there are medical causes for it. So let's deal with them one by one. The primary dysmenorrhea is you encounter a lot in young women who started menstruating for the first time. The pain normally starts either a day before or just the day she starts menstruating. In some cases, it might stop after 2 or 3 days. In some other ones, it carries on throughout the menses. The secondary dysmenorrhea might find a woman who for years never had regular periods without pain. And then suddenly in her mid-30s or late 30s, she starts having pain. This is, we call it secondary because it's secondary to something else happening in the body. The common causes of secondary dysmenorrhea are things like fibroids in the womb can cause secondary dysmenorrhea. Things like what they call endometriosis, where the inner lining of the womb grows into the muscle. Things like adenomyosis, where the womb is quite large, and when you're bleeding, it has a lot more contractions. Things like PID, pelvic inflammatory disease, can equally cause painful menstruation. And some women who are wearing the intrauterine device for family planning, in some cases, that itself could be responsible for pain during menses. And why do women have pain? For the primary dysmenorrhea, what happens is this. When the lining of the womb is shedding, there's a substance that's being released called prostaglandin. It makes the womb to contract. In some people, very strongly, and that gives you that pain. Most people, it's not that heavy, it's not that strong. They can bear the pain. But in some women, it becomes very severe and it requires medical treatment. The side effects of heavy menses, it causes a lot of emotional trauma in some girls. Some will miss school, some will miss work, some get very, very, very irritable. It affects their quality of life. So you don't have to suffer in silence. If you have painful menstruation, approach your doctor, or you can even buy the medications yourself. The regular things we use are any of the drugs you use for joint pains, things like Feldin, diclofenac, ibuprofen, because they reduce the amount of prostaglandin and reduce the pain. So you start taking them the day you start having pain, or even the day before. You take the Feldin after food twice in the morning and night. You can add paracetamol 2 or 3 times a day. You know the number of days the pain will last. Just take it for those number of days. Simple. And eventually, by the time you stop, the pain will have stopped. Those who have secondary dysmenorrhea will know the problems are there. If you have fibroids, if you remove it, the pain will go away. If you have endometriosis, we treat it, the pain should go away. And those with any other, if you have a pelvic inflammatory disease, see the doctor, get sufficient antibiotics, the pain will go away because these are secondary. There's something causing it. And when you deal with the cause, the pain will disappear. Is there a cure for menstrual pain? Well, studies have shown that once a woman delivers a baby vaginally, not by cesarean section, the cervix will be stretched and the womb will be stretched. So in most women, the pain will disappear. In some, it will reduce so much they won't need any medication. So there is hope for those who are having painful menstruation that once you have your first baby, and hopefully by normal vaginal delivery, that pain will either disappear or will reduce. But don't suffer in silence. If you have menstrual pain, it's not a spiritual attack. It's not your enemy is coming after you. It's a natural process. see your doctor. If you cannot, if your medications don't help you, then see your doctor. But if the medications help you, always have them at home. You know when your menses is going to start. Ideally, you should start it a day before the period. Then you don't experience the pain. And take those medications regularly for the number of days you know you usually have pain. And do that every month. Hopefully, the day you get pregnant and you're able to have a normal delivery, then you won't need them anymore. But don't be ashamed to talk about menstrual pain. You don't have to suffer pain in silence.